Hi, my name is Sonja Spencer, and my demonstration is on wound care. My granddaughter Samaya is going to be my patient for today, and my quote is by Langston Hughes. Hughes wrote, "What happens to a dream deferred? Does it dry up like a raisin in the sun, or does it explode?" Kind of like my life. I've been through a lot, and this is my demonstration today. Here we go. We start off like this. I'm going to do an isolated patient that has a stage 2 ulcer on their left lower extremities, on their left Achilles, on the bottom heel of their foot. And this is the lower extremities. And this patient has full-blown HIV, so we have to go in with protective clothes on. These are protective clothes, and this is how I start my day. These are just some of the things that I carry in the back of my car. I'm down supplies due to the coronavirus, but just work with me. Catheter, we call this a gun because this is different. You use this to put in the catheter. Different patients need different sizes. This is mouthwash from patients that have dry mouth and we want to give them oral care. This is a protective gown for patients that are isolated or that have, like I said, HIV, hepatitis B or C, and they have drainage and you need to protect yourself so you don't catch anything. More guns is what we call them. More catheters. Urinal catheters to put in for the patient, wound care supplies, bandage rolls, and we're gonna drain the balloon out of the to drain the balloon out of the catheter. You need this. It kind of works like this. Bear with me. You have to take it and drain all the water out of the balloon of the catheter. This is a squeegee that we use when we have small children. In a pediatric, they may need their nose cleaned, so we use, suction. We do both, the suction, but I don't have a suction with me. We do both. Scissors, lubrication for the catheter, and gloves. We have more gloves right here. Gloves and more gloves. You have a supply of gloves. You always have to have gloves all the time. And here's some gloves right here I'm using. And sometimes a patient may be bleeding. It may be a younger patient. Like I said, we get all type of patients, and they may need a Kotex sanitary napkin. We'll have that. Here's more utensils that we use to drain the catheters. Just different things, variety of equipment that we use and supplies for wound care nursing. We have this sometimes to measure. This is for mostly for patients that need a treatment, a different type of treatment that requires an RN degree. So they use this too. And those are right here are thermometer, oral thermometers. We use these. It's a set, and you put this on the thermometer to use. Okay, we're going to start off with my granddaughter Samaya. She's 6 years old, and she's going to be my patient for today. Say hi, Samaya.
Hello.
Samaya has a wound, like I told you, on her foot. We're going to pretend like it's a stage 2 open wound. First of all, we're going to start off, and we're going to have our gloves on, always fresh and clean gloves, clean gown. Never cross-contaminate. Always have your stuff ready and prepared before you even start with the patient's wound care. Everything has to be laid out, clean, sterilized, and put out so you can use it to do the wound care. We're going to start off with Samaya's foot. We're looking at it. We're going to measure it. We're going to use this as a measuring. Put your foot up a little bit, baby cat. We're going to put this and we're going to measure it, and this is how we measure it and see the size of the ulcer and determine if it's getting better or worse. Samaya's is getting worse, so now we're going to have to report that. And you always read the chart. You go in the patient's house and you read the chart, whatever the chart of the doctor has the orders on. And then you go, you follow the orders, you grab your paperwork, and then you start working, and then you do your documentation, everything that needs to be done to the patient, and how to follow the steps to do the wound care. We're going to pretend like we're cleaning it. Oh God, where's that spray? Okay, we're going to clean the wound right now. Well, just put out, Sonja. We're going to clean it up. We use some spray. We're going to put some antibiotic if an order is for it. Never do anything without an order. And then we're going to start putting some spray. We're going to measure it again, see how deep the wound is. Then we're going to start with wrapping it up. Now I got to try to hold that. This is the hard part because I'm wrapping the wound and videotaping. Very difficult, but it's going to get done. This is called 20 years of experience. We're wrapping it. We're wrapping it. We're wrapping it. Now here's the end result. Sonja, my patient, her wound is clean and dry, and she's ready to go. How does it feel? Do you feel any pain?
Yeah.
I don't see any infection in it. We have to see what the doctor says after I do my ADLs and make my report and do my charting, and then we'll report it back to your doctor. Okay? I'm going to say goodbye for today, and I'll see you next week. Okay, take care, baby.
Bye-bye.
Bye-bye.